Hi, I'm Don Patchen with Sarasota County Communications. Thanks for checking in on Facebook. Joining me today here in the studio is Chuck Henry, our health officer for Sarasota County Department of Health. Thanks for being here today, Chuck.
Pleased to be here. Thank you, Don.
So you just gave an update to Sarasota County Board of County Commissioners about vaccine and COVID. Let's hit a couple of the high points. You shared some information about clarifying the difference between the Sarasota County's registration system and the state registration system. Can you help our viewers understand that system better?
Sure, and that's a really important point. You know, about a week ago, the state stood up a statewide registration system to ensure that every county had access to a registration system, because not every county had their own registration system. Here in Sarasota, we do have a registration system already in place, and we're trying to utilize that registration system to pull people off the queue as vaccines arrive in the order that they registered. You can register in the state system, but if you're in Sarasota County, essentially that list just stays there in an Excel spreadsheet until we pull that list down, and it'll be added to the end of our registration list. So if you're already registered in our system, there's no value in registering in the state system. If you haven't registered in our system, I encourage you just to register directly in our system instead of being in the state system that then gets pulled down and added to the end of ours. It's just simpler if you go ahead and register, create an account, and be in line in our system.
That's a great way to understand the system for our residents in our community. Let's also touch on another thing about the registration system. If a person that's registered in the queue gets a vaccine somewhere else, what should they do?
So that's a really important point, because we want individuals to get vaccines, but if they have one and they got it somewhere else and they're registered in our system, they need to let us know. They can go in and delete their account, or they can contact through any of the social media, our communications team, and they'll help flag that account as first dose received if you want to stay in the system for a potential second dose.
So if they go in just to two options there, the social media option, and also they can call 861-VAXXES, VAXS 8297 to get some assistance on the registration system. So let's jump to another part of the registration. It was a topic at the board meeting, is 3 declines.
So again, because when we have vaccine events, we want to maximize the staff and the vaccines. Our goal is to put vaccine into arms. So when we send out the vaccine appointments, we're starting to see a 10, 15, 20% decline rate. And some of those are because people have already received it, so we're hoping that people go in and clean up that on their own. But we also understand that someone may have a doctor's appointment or some other reason to decline. So we allow 3 declines or 3 opt-outs, and then we'll move them to the back of the list, because we want to keep sending out appointments and getting people that are waiting in line vaccinated as quickly as possible. So it's important to know if you have a reason to decline, that's okay. But if you decline 3 times, we're going to move you to the back of the list.
Right, and that confirmation is still imperative when a notification goes out to a person to either accept or decline, but to take some action so you can make sure you fill your slots at the clinic.
Absolutely, because we really want to fill every slot and deliver every vaccine we have.
Something else that I know the board asked about, and anybody reading the paper, watching TV is hearing about, is Publix or other national pharmacy chains. Can you share what you know about what's going on with that, Chuck?
Sure, and Publix has been in the news for a while in our state because the governor has an initiative to work with Publix and send some of the state allocation to Publix to create more outlets in communities. Just last week, the federal government announced a direct ship pharmacy program to some of the national pharmacy chains. So we'll be seeing both of those coming online in the Sarasota area over the next few weeks. Their registration systems are separate from ours, and so you'll need to go to their websites to learn how to register with them. And again, it creates more outlets in smaller environments, more widely dispersed across our community, so it's a good thing. But I would keep, if you're waiting for your vaccine, I would register with Sarasota County, stay on our list. You can also try to get into one of the pharmacy outlets when they open up. And if you get a vaccine, just don't forget to come back and change your status in our system so we know that.
Well, I know you say it every time I hear you speak, you talk about getting vaccines in arms. I know your goal is to get as many out there as possible, but still it's the allocation that your department receives from the state.
Right, and I think it's important, if you look at the state reports like today's report, says that there's been 50,000, more than 50,000 doses given in Sarasota County, which is absolutely true. That number is cumulative of what's happened at the hospitals, what's happened in our long-term care, and what's happened with the health department. The health department alone has only received about 15,000 doses and pushed those out as quickly as we get them. And so it's the doses the health department gets that are coming off of the registry list and the number there. So it's important to understand that distinction. We're serving about 11,000 in terms of record number. And I know that 11,000 is less than the 15 I just mentioned. That's because many records have two individuals in them. But you can keep track of your account number, which is your registration place in line, and follow where we're at in terms of vaccine numbers we're serving, account numbers we're serving, compared to your number, and know how close you're getting.
Excellent point, Chuck. Thanks for being here. We want to hit those hot topics from following up to your report to the Board of County Commissioners. Thank you for tuning in to Facebook. I want to encourage you, if you do need information, go to scgov.net. Right at the top of the website is a purple banner that takes you directly to COVID and vaccine information. Or if you have questions about your registration number, call 861-VAXXS, VAXS, or 8297. Thanks for tuning in.